When people are thinking about their first years out, what really helps a person grow? What type of traits do they need to have?
Humility and the willingness to look like an idiot. I think that what's going to help you grow is going into your internal medicine rounds or going on an ER case and genuinely, when you don't know something, being like, I don't know what that is, or I don't know why we're doing this. And if I were to summarize it, I would say the willingness to look like an idiot. That is going to help you grow. Just because you're now finished your veterinary school and now that you are licensed doesn't mean that you know everything. And so the willingness to look like an idiot and the willingness to say, I truly don't know this, can you explain this to me, in a room full of people and look stupid, I think is the way that you're going to grow.
Jake, how's everything been?
It's going good, man. A lot has happened in the past few months since we last spoke. So
I know. Yeah.
Life's good, man.
That's why I want to. I want a full ass breakdown of everything and anything. Because congratulations, though, you got engaged.
Correct. Yeah.
And congratulations, you're going to Penn for a surgical residency.
Also correct. Yeah. I'm really excited. Yeah.
Wow, man. You followed that dream, huh? You just followed that dream to be a veterinary surgeon.
Mm-hmm. Yeah. And I still got a ways to go. Don't get me wrong. But it feels nice to be done with the match process, to be done with kind of all that stuff. And now it's more of like, all right, now it's your turn to learn how to be a surgeon, not doing all these things to get the opportunity to then be in the room where you can then learn. So it feels good to kind of take that next, I guess I want to say final step, but it's still a ways to go.
Yeah. Well, so are you doing a veterinary surgical internship and then a residency, or are you right into a residency?
I am fortunate that I got straight into residency, which it is very common to do a specialty internship right out of your rotating and then go into residency. So I'm fortunate that I have the opportunity to just go straight into residency. So it's a 3-year residency program. Penn is awesome, and I'm really excited. So I couldn't be more excited to join the team over in Philadelphia.
When do you start? How long?
July 13th is my orientation date, and then I think I start on clinics that week. So it's gonna be fun.
Welcome. Let's go.
Yeah.
Right.
Yeah. Well, exactly. Yeah.
So, man, so many questions. Let's talk about the residency part, and then I want to go over the internship and all that stuff. So, the residency part, do they still expect you to have training wheels on, or are they off?
Yeah, and I've had great mentors in my life, and we've talked about that endlessly. But so at UGA, I've had an amazing mentor who's an orthopedic surgeon who I admire very, very much. And we were talking about this, and she was saying, when you start a residency, you're not expected to know how to be a surgeon. That is what residency is for. So you're absolutely training wheels. You're not expected to know how to do all these complex things. You're expected to have the attitude of, I'm here to learn, and I'm going to have a positive attitude every day. That's what your expectations are. And then you just kind of seep in all that knowledge from all these different mentors that are in the surgery department. And then you get to the point then in your residency where it's like, yes, the reason you have done a residency is that so you can learn how to do surgery. You have now learned how to do surgery. You have passed your boards. Now go be a surgeon. So it is not the expectation that I know how to do, a thoracotomy day one. So.
Yeah. Okay. So let's talk. Well, let's say you have the. So when do they call you in at 2 a.m. to do the thoracotomy? Is there some sort of guideline to that?
Yeah, usually you're on you have close supervision for your first, few months there, where everything you get called in on, some programs, let's just talk in general for anybody who's interested in residency or surgery residency. But so some programs will have a senior resident that you are on with, so if I get called in at 2 a.m. to go do a foreign body surgery, the senior resident, or at some programs it's faculty, will come in with you regardless early on. And then so you will have that supervision with you. And then at a certain point in your program, usually it's about 6 months, you then are kind of let off leash, I guess, per se, where you no longer have somebody automatically come in with you and do the surgery with you, but instead you now have that person as a backup that if it's something more complex that you've never done before, like if, let's say it's a traumatic diaphragmatic hernia or something that you've never, that's not as routine as just like a foreign body, you have the option to either call that person in if they want to come in or you're not comfortable, but also they're on backup in case you need something. You're in the OR, you open up the abdomen, and it's something you didn't expect. You can then contact that person. So you're absolutely still supervised.
Exactly. I call that the peek and shriek.
Yeah, exactly right. Yeah.
So that, I mean, that sounds amazing. Now, when you go in, like internship, you kind of sit there and watch. When you get there, are you going to go in there and watch, or are you going to start doing? And they're just there as a cheerleader, supervisor, giving you information as you go.
Yeah, and it depends on like one if you're primary on the case, and I'm sure it's kind of case by case. If it's something more complex that you're not equipped yet in your training to do so, like being a first year resident, you like maybe the senior resident will be the primary surgeon, or the faculty will be the primary surgeon, but there will be opportunities where you're a lot more involved and you're a lot more doing things. Sometimes, depending on the case, you may be doing the entire surgery with your faculty right next to you, walking you through it. I think it depends it's a case by case basis almost. And I, admittedly, I don't know exactly how Penn does these intricate things. Every program probably mentors a little bit different. So I can't speak for other programs, but I think that's kind of what it's like for the most part. Is it depends on the case. And you will get opportunities to do things, especially if you're the primary clinician on that case. And that's, how you learn is by, doing things and doing things under supervision. So
let's look back at your last year. Who is Jake now compared to the Jake I talked to 2 days before he graduated vet school?
He's a lot less green. He is a lot more comfortable with things. And I think your internship not only challenges you as a clinician in your education, but it also kind of challenges you as a person. So I feel like the person that I was when we first spoke, and I was all like giddy and like, hey, I just finished vet school and all this stuff. And it's now like I've gotten a lot more, I'd say, just like medically mature and kind of see the world of veterinary medicine very differently, instead of being the gold standard of this is how you treat things. There's a real world out there where when you're on the ER or you're in on internal medicine, client communication, looking at the patient in its entirety and deciding what's best, as your job as the advocate for that patient and the guide to these clients. I think that switch has changed a little bit in me, and it's mainly just experience. So I think overall, I have learned a ton, which is the point of an internship, to learn. So not, I'm just a lot more educated, but also I think I've kind of come to this understanding of what the real world of medicine looks like, and that it's not what you learn in vet school on paper, because that doesn't fit every case. Every case is individual, every client is individual, every client's circumstance is individual. So I think I'm a lot more, I would just say, if that makes sense, like more medically mature in my understanding of the best way to go about practicing medicine.
But you said there are things you feel comfortable with and not. I'm curious, what do you still feel uncomfortable with right now?
I mean, it's hard to being a doctor for a year is not enough time to sit there and think everything. I think like for people that are just starting their internship or just starting practice, it's like, don't expect to be good at being a vet right away. Like you're going to suck at it. It's just how it is, because you've never done it before. So why would you expect to be good at something that you've never done before? That's completely irrational. And so I think, there's in a year to be able to say that I am an expert in veterinary medicine is a totally incorrect statement. Does it mean that I've gotten a lot better? Does it mean that I'm at least, I would say, proficient? And I mean, I finished my internship. That means I'm proficient because I finished the internship. And so I think there's a lot that I don't know in terms of there's cases I haven't seen in particular. There's particular procedures I've never done or things that I'm not comfortable managing. And so there, it's a never, you're never done in this profession. Like you've never like graduated. Now you're a vet and you're done learning. That's the moment that you make mistakes. And that's the moment you fall behind. And that's like the moment that you get comfortable in your ways when there's better ways to do things, or you stop learning. And then that's a detriment to your patients and the clients that are trusting you to take care of their loved ones. So I think there's just a lot in general that I haven't learned, and I don't expect to know it at this point in my career.
Are there things now that you're going to be a surgeon you expect not to learn at all?
Good question. Oh, you always ask the best questions. I'm definitely going to, I'd say, fall out a little bit in terms of like my understanding of managing like a case that has like an internal medicine case. Like there are going to be there are going by choosing to specialize, you are becoming an expert in one thing and a absolute novice in another thing in other realms, and that's what choosing to specialize is, and that's why you give primary clinicians some degree of kind of like you tip your hat to them because they're kind of expected to know everything because they are kind of the general referral center or referrals for the referral centers. So there is definitely, by choosing to specialize in surgery, there is going to be a lapse in just in my knowledge in certain cases, just because I won't be treating a DK case ever again, most likely. It's going to be, and that's just something that, in order to specialize in something, like if you have a bucket of water that you can only fit so much knowledge into before it starts overflowing and you start, knowing too much and not becoming good at anything, you can only put so much in that. And if I'm choosing to put all of my surgery knowledge into my bucket of knowledge of veterinary medicine, I'm going to be sacrificing my ability to treat, particularly more complex physiologic cases versus something that's surgical. And so that's just something you have to willingly accept. And I'm completely fine with that because all I want to do is surgery.
Is there anything you believe you did not see during your internship that you wish you did?
Great question. Yeah, I mean, there's definitely, I've seen like a lot of trauma cases, a lot of sepsis cases. You know, I guess one case that I didn't ever see on ER that maybe I wish I saw in terms of the workup was like a septic abdomen. I didn't ever have the experience of like intaking a case that is septic and it's from a septic abdomen or something like that. So that I think particularly with surgery would be useful. I also never. I did all my research in ureter obstruction. I'm actually presenting at ACVS my abstract for a retrospective for ureteral reimplantations in cats, but I never intaked a ureter obstruction case. So, and that's just the experience of it. Like my intern mates, they diagnose septic abdomen cases, they diagnose ureter obstruction cases, but they also maybe have never seen a bladder rupture or a GDV before. So it's just the way it is. Like in 1 year, you can't expect to see it all and know it all. So
looking at your intern mates, what are they doing?
most are specializing. There's a good bit that are doing surgery as well. One's doing a surgery residency at Cal Davis. Two is doing an internship. Two want to do a neuro residency, and they're both doing specialty internships. Some are doing ECC and going into residency. So one's doing ECC internship. Most are specializing.
So everyone decided to specialize.
Yeah, at least from where I'm at. I think I know where you're leading with this question. Do you think you have to do like an internship? Is that kind of where you're going around?
Well, no, I was just going like, look, well, I mean, yeah, but I mean, I'm more interested in like, out here, there's a lot of docs doing relief that have only been out a year and a half. Do you think you're ready to do a relief shift in a general practice?
In a general practice, I would be comfortable. And I think, yes. And I think similarly, like if I were to go work in ER right now, I would be comfortable in doing so. There's definitely still a gap of knowledge, but I would be comfortable, especially if I was like left alone on like an overnight, or if I was left alone in the ER with no other doctors and no backup. I think I would be comfortable. At least I wouldn't maybe always find what's wrong initially, but I could at least, I feel comfortable in stabilizing and assessing when a patient is unstable or they need, something to keep them basically alive until it can get seen by like an internist or, a surgeon or so.
Do you feel comfortable enough to go in and do your own GDV right now?
Surgically?
Yes.
I think yes, but I've never done the actual gastropexy myself on a live animal. So if let's say like in this fictional or fictitious situation that I don't have any backup and I'm the only person in the world that can do this dog's gastropexy, do I feel technically competent to do it? Yes. Would I be nervous? Yes. Would I prefer to have a boarded surgeon in there with me or somebody who's done them before? Also, yes. But I think, do it.
I've done many elective gastropexies. I could teach you how to do a pexy really quick. And that
Yeah.
whole belt loop thing is a pain in the ass. The incisional is a pain in the ass. I do a muscle flap gastropexy because it allows the stomach to move.
Oh, nice.
I've had to go in and remove lodged intent, like 3 years later, intestine gets lodged up around that belt loop. Incisional, it doesn't allow the stomach to move, so it actually caused like almost a quarter twist to it. So that's why I'm just asking. I was very blessed too with great mentors, and I took an advanced surgery rotation kind of my last rotation in vet school. And basically I walked in there and I told the resident, I'm like, okay, I'm doing this C-section, I'm doing this GDV. And it's because, I'm like, okay, I can't do it today, but a week and a half from now when I have my diploma, I can do it. That doesn't make sense. So, I just, because, I defended my dissertation, so I'm done with that. And, the thing is, I'm really worried about the education piece of veterinarians coming out.
Mm-hmm.
You came from Wisconsin, right?
Correct.
Where were all your other internship people from?
Some were one was from Texas A&M, one was from Michigan State, one was from Costa Rica, a dear friend of mine, and then one was from Taiwan, one was from Penn, UPenn, and then another one was from Tennessee. One stayed from Georgia. I think that's everyone.
In your opinion,
so all over.
In your opinion, were you all just as prepared, or do you believe that some were more prepared than others?
I think maybe some were. I think we were all prepared in different fields. Like I feel like for the most part, everyone was at the same playing field in terms of their like. If you look at it kind of on a macroscopic scale, but when you break down to like, if a neuro ER case comes in, like my intern mate that's interested in neuro is going to know a lot more than me. So I think it's almost that what people were in general, everyone was kind of on an even playing field, but we were all kind of uniquely better than each other at whatever our subsect interest was, if that makes sense.
Yeah. Did you see any anal gland abscesses on ER?
I had one. Yeah.
Oh, you had one. Any broken toenails?
I had broken toenails for sure.
Oral hematoma?
I had one oral hematoma case that is not why the dog was there. And so I just said, this is not an emergency. Like I'm going to fix your dog's actual emergency. But the oral hematoma, you can go get that figured out with your primary vet.
Yeah, because like one of the talks I did at PacVet for the early career track was things that you never saw in vet school. It was like anal gland abscess, anal gland
Yeah.
impaction, anal gland infection, oral hematoma, broken nail,
Mm,
elbow hygroma, like all
yeah.
those all those things that you really don't see. And
Yeah.
I just feel as if sometimes the interns coming out get stumped by that. But I find it interesting. None of the interns are going into general practice.
No, not. I mean, some I think maybe talked about if they're doing like a specialty internship and they don't get a residency the following year that they might. Um, but none of my intern mates did.
Now, out of your class out of Wisconsin, have you kept up with any of the other ones doing internships?
Yeah, I have really like three, really, really close friends. One went into a kind of mixed animal practice vet in
Mm-hmm.
Wyoming, and we talk all the time, and he's doing crazy stuff. He's awesome. And then another one is finishing up his rotating internship at Wheat Ridge, and now he's doing a specialty internship at Wheat Ridge in cardiology, which he was undecided. Last time we talked about, like on the podcast was I brought him up because he was unsure of what he wanted to do, and he actually ended up wanting to now go into cardiology. And then my other friend, who's a primary clinician in Charleston, South Carolina, we like us three, that group of guys, all four of us, we chat all the time.
How about any other classmates that did internships? Do you know any of them? Do
I
you
don't
talk
really
to them?
keep in touch with yeah,
Okay.
not like directly, but of course I see on social media, and most that did a rotating internship are now going into residency or a specialty internship.
That's interesting. Yeah, that's a pretty high percentage so far that are just totally bypassing GP.
Hmm.
What what did your uh, directors of your program tell you about GP? Will you guys ever talk about it?
In like what capacity?
Just what their opinions were. Like,
There,
did they really know much? Did they come from GP? Did they ever do GP?
yeah, there were. I can't think of any like directly, but there were a select amount of clinicians that did general practice before they did their residency or before they, were now, faculty. Like they started in general practice, so it is, there is some kind of understanding between like if you look at a specialist center where they do kind of have some experience, but I think in general there's a lot of just like respect for primary, general practitioners, just because we like I don't know. We understand that as a, like in a specialist hospital, you understand how important their role is, and like kind of one of the I guess benefits, especially when you're on like a rotation like medicine or surgery. A lot of times the dog is cat is coming in with the diagnosis that the general practitioner has already done it everything for, and now you're as the specialist working on like managing the complexity of it. So there is just there's an overall like a lot of respect for general practitioners, and I guess kind of that we tip our hats to them for the most part. Just kind of my experience being in a specialist.
Is there anything you wish vet school would have prepared you for better now that you're done with your internship?
Um, yeah, I think like more time just on clinics, and I guess more, more, you can always critique about how things could always be better. And, in general, I felt very prepared for my internship. And I want to say that like the current, or at least curriculum that I had at Wisconsin did a very, very good job of preparing me. Do I wish I had more like hands-on experience and more time in clinics throughout my career or throughout my education? Because the only time we spend in clinics was our fourth year, so it would be nice to have a little bit more experience throughout like your third year. um, but you can always make critiques, and you can always say that it's better to have this, better to have that. But I think overall I'm very happy with how I was prepared for my internship.
Any advice you'd give to any vet students out there right now that would like to get more experience? Do you think it would be good for them to go out on
Mm.
their own and try to get more hours while they're in school?
Yeah, I think externships and some programs allow more externships than others. But utilize your externships as much as possible, and like not only going to like your local primary or general practitioner that you've worked at before, like use those externships to maybe go to a different specialist center in private practice. Or what I did is I went to a lot of the different universities. So it was really, really nice to see how different universities did things and just kind of their different, you know, and this is something that I kind of reflect on now after having been doing that. When I was originally doing these externships at these different universities, it was more so to see where do I want to go for my internship. So I didn't really do that for the purpose of seeing what other programs did, but now in self-reflecting on it, it was really nice to see how Colorado State does things versus North Carolina State versus Wisconsin versus Georgia. And so I think it kind of, because there's a million different ways to practice veterinary medicine. And if you poll 50 veterinarians about one case, they're going to, all have different opinions on what's the best way to manage that case. So I think it's utilizing your externships to see how different things are done kind of, opens up your mind a little bit.
When you look back at this past year with your intern mates, did any of them ever say, I'm done, this is not what I signed up for?
I mean, there's definitely hard days, and everyone finished the internship, but there were definitely days where, myself and my intern mates were struggling. And like, an internship is supposed to be hard. It's not supposed to be easy. It is supposed to be difficult, but that's how you
Hold on.
learn.
You
So,
told
like,
me you're going to be able to go train for ultra marathons and go do all this stuff and go do this and go do that.
Yeah, I mean, it is a difficult year, and you have to be willing to sacrifice. And like, you're not going to be able to go see your family as much. You're not going to be able to go hang out and relax as much. You're not going to be able to, for me, run as much. Although I did do a 100-mile race in December. I did do that.
I remember you told me you nearly died.
Yeah.
You nearly died.
Nearly died. I would, I would love to talk about that as well, because that was insane. But But yeah, it's like there were definitely points throughout your internship where you get home and you're just sitting there and you're like, I'm not cut out for this, or like, this is just too much. But I will tell you that you are there. You got selected to be there. You graduated veterinary school. If you are capable of doing an internship. You are capable of making it through. You are the right person. You do belong there, by the fact solely that you are there and that you have earned that spot. So it is supposed to be hard, but it is not impossible to get through. And definitely it is going to be a challenging year for anybody doing an internship, but you wouldn't be there if you weren't cut out to be there.
I remember you told me last time you saw your first humbling case pretty quick, right? Did you continue to have humbling cases throughout the year, or did you learn how to manage the situation better?
I definitely learned how to manage the situation better. There are definitely humbling cases though, where you learn by fire. I mean, that is unfortunately the profession that we chose to be in, is one where there are consequences to making mistakes, and things are like, you have to be perfect. Like, you have to, every time you draw up, this is one thing that I've thought about all the time, is that every time you draw up a medication to give to a patient, like, your math has to be accurate, or else you could really cause some harm. Which on an ER, when I'm on ER, the amount of times I'm drawing up a medication, for sedation or something, it happened like it is 20, 50 times in a shift that I'm drawing up a medication. And so like, you have to be on it at all times, and you can't slump on your math. One calculator mistake, you could really inflict some damage. So you just have to be on it all the time. And it's hard to be on it all the time, and it's hard to be perfect. And there's absolutely going to be times where you sit, after your overnight shift, and you just got rocked and you saw 16 cases and none of them are healthy or stable, and you didn't manage them perfectly. And I'll never forget this one ECC resident. I had a really difficult night on one of my ER shifts. I had a really difficult case, and I didn't think I was, the dog was fine, but I didn't think I did it, like managed it the best. And I kind of, I guess just with the chaos of the night, I didn't think I did my best job. And I was talking to the ECC resident, and she said to me that your job is to stabilize and keep it alive overnight until the intern or to the specialist can get here in the morning, and you did your job. And so even though we're not perfect, it's you're never going to be perfect in the profession, and that's what makes it, a challenging profession. But to kind of keep in mind that I, particularly in your internship, it's when you're on those overnight shifts, it's like your job is to stabilize. Your job is not to come up with all the answers. Your job is to basically keep it alive until the morning. So I think that was a good lesson for me. And it's like there's definitely humbling experiences where you wish you were perfect and you want to be perfect, but it's okay that you didn't maybe have all the answers, or you maybe underestimated something, or you missed something. Um, at the end of the day, it's like at the end of the day, throughout my internship, my theme of the year was I want to get good at this and I'm trying my best. That carried me throughout the entire internship, and it gave me some grace when I wasn't perfect.
Were there any big mistakes created by your internship class that you can remember?
Not that I can recall. Nothing like catastrophic. Like nothing like where there was a risk of, or like some sort of complete medical mistake. Not that I can recall. And a lot of that is a credit to the supervision that you get in your internship. It's like you have a hospitalist overnight with you. You have backup. You can call a specialist. You can call your faculty. Every faculty, they will, on your overnights, they will be like, if you are lost or confused or struggling, call us. And so a lot of times, a lot of these mistakes can be mitigated by knowing when you don't know something and knowing when you're out of your depth.
How many times did you call?
I call a specialist about a case. I would say pretty regularly, because it's just you want their advice, or their kind of like for example, if I had a dog in heart failure, or an arrhythmia, I would call the cardiologist, and that was just kind of protocol. Is like call the cardiologist, and they're happily going to walk you through the case and recommendations.
Were they
But
were they happy when you called them at 1 a.m.?
Not always, but they're happy to do their job. And so it wasn't always where they were like super excited that you're calling them at 1 a.m., but they understand that that's their job, and so they're going to happily give you their advice and everything. If there were times where if I had to call like a faculty where I was genuinely like, I don't know what is wrong and this dog is unstable and I need help, that only happened maybe 2 or 3 times.
How important were the technicians to your
Oh my
success?
Oh my God! I mean, they are the lifeblood of any hospital. I'll never forget the worst overnight I had was I saw like 16 cases, and I'm the only doctor in the ER. I have a hospitalist that's in ICU, but everything in ICU was not doing well either. So that hospitalist was unavailable to help me. And I had not only students with me until they were supposed to be like done at midnight. They voluntarily stayed till like almost 2 in the morning. And then I had one overnight technician with me in the ER, and then a few assistants. And the amount of times where like in that night where I would just be like, I need to go talk to this owner. This dog is unstable. I'm working with this dog. Can like you go take the x-rays on this dog? Can you blah, 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 like just delegating. And that is a skill in itself. To be able to delegate is huge. And that allows for a cohesive team to work together. Like veterinary medicine is a team sport. Absolutely. And I cannot thank my assistants and technicians for their work and support overnight. If anyone listens to this, you know who you are. So we've had some brutal nights together, and they've all really stepped up.
So, would you tell people who are just graduating or just vet students right now, how important is it to use and trust your team?
It is The team it can't function without it. I would say it's one of the it is one of the most pertinent things to consider in a practice. To not only have a team that have a good attitude, because a negative attitude is way more infectious than a positive attitude. So having a positive attitude about work and enjoying the profession, that's very important. But also being able to kind of like work as a team. Um, the hospital can't function without it. And so I would say I if we're going to consider things working in a veterinary practice, I would say the hospital culture is the absolute number one thing to consider. Um, you know, I would consider that over the pay. I would consider that over the equipment that the hospital has. I would consider that over the geographical location. I think by far the staffing culture is the most important thing.
Were there any tricks that the technicians taught you that you're going to use to this day?
Um, maybe not like just technical tricks, but just like in general, like the technicians know a lot about
A lot.
they just know yeah, they just know a lot. And so there were so many times that like I'd have a case of a dog that, comes in for, whatever, and the technician will be like, "So, do you think we should blood type this dog?" And I'm like, "Yes. Let's blood type the dog." Like there were so many times where they would just like save you because you're not considering these things, or you like they've been in the profession for 20 years. It's like maybe they know a lot more than you do. They've they just because they don't have a veterinary license doesn't mean that they don't have the experience and knowledge more than you do as well. So there was a lot of times that they just would save me in terms of their recommendations, or they would know how to do things. They would know how to put these dogs on a CRI or something like that. Then I'm like, I have no idea how to do that.
And they also give you hints too. I mean, if you have
Yeah.
good technicians, they're like, "Oh, Dr. Smith used to do this," and you're like, "Oh, that's
Yeah.
a good idea,"
Yeah.
And
Yeah.
but you got to use your team, and it
Mhm.
blows me away how many don't, and I just don't know why that is. I don't know if it's a pride thing, an ego thing. I have no idea, because your first years out, you're basically trying to survive and learn the
Yeah.
game and do all those things. Was there
Mhm.
anything you thought was going to be hard, but it turned out it wasn't?
Um, I think the client communication was, I thought, a lot easier than I thought it was going to be, because there was a lot of times where you like, I don't know, you especially with like this era of like chat GPT, and like where owners come in very prepared and very knowledgeable of what's going on, and they've done their own research. I thought that I was going to like walk in rooms and be clueless, and I was going to lose trust with owners. But I think you know a lot more than you think you do, because like owners would ask me a question about something that I wasn't anticipating. And I just like, I knew the answer because of my schooling, or like I can recall a case that I'd seen previously. So I think the client communication, and in general, I'm more of an extroverted person, and I'm okay with talking to people. But I think the client communication and earning trust with owners was easier than I thought it was going to be.
Do you believe because you're an intern, the owners were a little easier on you, or do
I
they
would say the opposite.
they were harder on you?
I would hear multiple times that like owners would come in either like with the knowledge that you have interns here working the ER. Like they would come in and be like a little bit like, well, I don't want to see an intern. Like, like I don't want to, I want to see a faculty or like a resident, or, like, so there were times, and I thought owners never really had that issue with me in particular, but I have heard things of where owners would be a little bit more, they'd be a little bit more cautious because they know that there's going to be an intern seeing the case. But then also some owners were very grateful. They'd be like, "Oh, you're an intern. Where are you? Where did you do your vet school?" And they were super, friendly and excited. So
Well, you're also in the South, it's a different
yeah,
way of life down there,
yeah.
Um, talking to your classmates that you said you're still close friends with, do you think they're having a harder time with clients than you are in your internship because you're at a referral center?
I That's a good question, my general practitioner friend in Charleston, I think kind of relating to what he deals with is a lot of times like at a referral center, your owners are predominantly coming with, they know what they're getting into because it's a referral center and they were referred there. So they don't get sticker shock when they hear what the cost is for things. And they're like, I'm here because I want to do things. Versus I think my friend in private practice, deals with a little bit more difficulty with that because a lot of times like owners don't have finances and they're like, I can't even afford $1,000, hospitalization and surgery. And so they have to kind of, I think, manage a lot more of the frustrations with owners, particularly when it comes to finances and what limited things that they can do. And so there is like kind of this referral world where, there's a lot of kind of glitz and glamour with it. And then there's also the general practitioner world where it can be a lot more difficult, I think, to provide options for owners versus me on ER. I'm like, all right, we can admit, we can transfer to medicine, we can get a surgery consult, we can get a cardio consult, we can do an echocardiogram tomorrow, we can do an abdominal ultrasound tomorrow. This is all going to cost this amount of money. And they're all like, yes, I was aware of that. We're all good. Versus in private practice, it's like
Can't
a
you
lot
just give
harder.
it a shot, Doc? Come on.
Oh yeah, and a lot of times like my general practitioner friend will be like, I'm doing this surgery and it could potentially be like something that a surgeon should do. And he has like a mentor that is very good surgeon, so he knows his limits as well. But he'll be like, they don't, I asked them to refer to, a specialty hospital, but he's like, but they can't afford it. And they said, why don't you take a shot at it? So,
Yeah, I mean that's how it is in general practice.
mm-hmm.
And that's good though that you got that reference down because you still have your friends in GP because
Mm-hmm.
cost of care is crazy and a lot of GP is cost of care discussion on every
Mm-hmm.
appointment. And get doing the relief that I'm doing right now, I'm seeing that a lot. But you just work through it. And I'm just lucky because I have all those miles behind me now that I know how to. It's an art form, it's a game, I don't, whatever you want to call it.
Mm-hmm.
It becomes easier. It becomes easier. Looking
Mm-hmm.
at all the senior students you were working with, would you say any of them were were afraid?
Oh, for sure. And like, I mean, I was too. Like, it is like it is scary. Like, it's a scary profession for sure, and there are a lot of risks, and it's hard when it's very intense and you don't know what's going on. And so, yeah, absolutely. There were lots of students that were afraid, or a lot of students they felt like they didn't know what was going on, and so, but that's normal. That's how it should be.
Any overconfident students, do you think?
I think, there are some times where I guess maybe there is a little bit of not knowing what you don't know, which can be a little bit dangerous. But all the students I worked with, for the most part, were, they were phenomenal. And I thought that there's not anybody in particular that I can think of that I would be like, oh, you were a nightmare to work with. I'm going to miss a lot of the students that I got to work with.
Well, that's good. Is your fiance a veterinarian?
Yeah, she was actually a student, and so I know, taboo dating a student, but
No, 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 no. It happened at Illinois too.
yeah,
There's three I can think of that ended up. Uh, one married a resident, and two married an intern. The interns. It
yeah,
happens.
and
It happens.
yeah, yeah, and she is now starting her rotating internship at Texas A&M. Um, So she also wants to do surgery as well, and she is as sweet as she is fierce and tenacious. Like she's a
Okay.
go getter.
How are you going
She's
to
the
make this
shit.
work? How are you going to make this work now? You're in Penn doing a surgical
Mm-hmm.
residency, and she's going to be doing an internship at Texas A&M.
Mm-hmm.
Are you guys just going to kiss and like be like, oh, I'll see you in a year, 2 years?
We're yeah, so we're of course we've had discussions about what takes distance relationship, particularly in our specialty, or like what we're doing. We're going to be very time consuming, but we'll be able to see each other somewhat regularly, every 6 weeks or so, and we're both going to be kept very busy, so that kind of helps with making time fly by. And then one thing that's also nice is that her family is also in Philadelphia, so she doesn't have to split time visiting, which is also really nice. But yeah, it's something we've talked about at length. It's not ideal, but so many couples in veterinary medicine and in human medicine. I have a lot of friends in human medicine that are doing 4-year long distance relationships, and so it is not something that we're necessarily worried about, to be honest. And we are obsessed with each other and have a lot of trust in each other. So the time will go by quick.
Yeah. Well, the time I can't believe it was a year ago, over a year ago, that I talked to you for the first time.
Yeah, right.
Isn't that crazy? That is crazy.
Yeah,
Well, I will be in Philadelphia in August, so I definitely we need to hook up because
absolutely.
I,
I would
I'm
love that.
I'm talking to the Academy of Management about my research. So and then
Awesome.
and then I need you to get me into Penn so I can talk to the vet students.
Yeah, absolutely.
Yeah.
Yeah, just let me know when you're there.
Yeah, I absolutely. Now going into this residency, is there anything you hope it changes about you? Is there anything you feel like you still got to tweak other than more
Yeah,
confidence in the surgical room?
yeah, really good question. I feel like I hope to become a stronger leader in the OR, particularly, um, because especially when you're like the surgeon doing the surgery, you need to be a strong leader. And I think that in my internship, I could feel myself becoming a better leader when on cases and being able to delegate and be able to kind of encourage and all those things. But similarly, I think with surgery, I hope to not only, like you said, be more proficient in my surgery skills. That's the obvious answer, but also I think become a better leader as a veterinarian and particularly as a surgeon in the OR.
What leadership skills don't you want to have?
Mm. I think like what makes like a good leader is somebody that the is selfless and can trust and the room trusts them. So I want to obtain those skills and be able to delegate. What I don't want as a leader is somebody that I guess is maybe entitled or expecting just because I'm a surgeon now or going to be a surgeon now doesn't mean I'm not too good to mop my own OR floor. Particularly, I don't want to get this inflated sense of I'm bigger than everybody else, or me being like the surgeon or being the leader in the OR. It doesn't make me better than anybody else, from the anesthesia team to the scrub nurses to the janitor. Um, that is something that my original mentor that I worked with, I've had a lot of mentors. My mentor that worked with me in my throughout my vet school, who's a surgeon, that's something we used to say is you're never, you've lost your way when you think you're too good to mop your own OR floor.
Exactly. Take out your own instruments,
Mm-hmm.
set up your own OR room. So, and it's very important, and I hope the listeners, transformational leadership is the way veterinary medicine should be. And that is something that you should read up on because you want to be able to transform your team that works for you. You want them to believe in your vision, your mission,
Mm-hmm.
and what you're doing. A strong transformational leader, their team will go lay out in front of a bus for them. So I hope there's things that um, you do pick up. And remember, as important to learn from the people what you want to do as also what you don't want to do. And the
Mm-hmm.
one thing I beg of you is, if when I go hear you speak, do not say this is how we do it at Penn, please, because at Penn is usually how they start their talks.
Oh, great.
At least you're not a VMD.
Yeah, for sure. You know what's funny is my grandpa was a large animal veterinarian. So he came over from Lithuania, and then he did his veterinary training at Penn. And so he was a VMD, and so he used to tell my dad, um, he would say, "Oh, I'm a VMD. Most people are DVMs." And my dad would say, "What's the difference?" And he's like, "Well, a VMD is better than a DVM." So it's kind of a fun joke through the family.
When people are thinking about their first years out, what what really helps a person grow? What type of traits do they need to have?
Um, Humility and willingness to the humility and the willingness to look like an idiot. I think that what's going to help you grow is going into your internal medicine rounds or going on an ER case and genuinely, when you don't know something, being like, I don't know what that is, or I don't know why we're doing this. And like if I were to summarize it, I would say the willingness to look like an idiot. That is going to help you grow. Um, just because you're now finished your veterinary school and now that you are licensed doesn't mean that you know everything. And so the willingness to look like an idiot and the willingness to say, I truly don't know this. Can you explain this to me? In a room full of people and like look stupid, I think is the way that you're going to grow.
Well, man, Jake, I am so proud of you. Even though it was impossible to even get you on almost this podcast this time, but I was still able to do it. But I think I love the fact that you said the importance of the team. I love how you said you need to become a better leader. I love how you said you still have humility and you still have a lot to learn. How, last question, because one of the traits that what I call in my dissertation the gatekeepers, who basically are accepting students into our profession. It's not the people working the profession that actually accept the students. It's the academic gatekeepers who do it. And one of the traits they look for, obviously, is perfectionism with the perfect GPA and everything else.
Mm-hmm.
How would you tell a perfectionist to that it's okay to look stupid?
Yeah, really good question. Um, because we all are perfectionists. Like that's what got us here is, and we beat ourselves up when we're not perfect. What I would tell them is that everybody that you want to be like, or everybody that you look up to, or everybody that you admire that's really good at what you want to do, at one point they sucked at it. Every surgeon was nervous the first time. Every surgeon that I admire was nervous the first time they scrubbed into an OR. They were nervous the first time they made their first incision. They were nervous the first time that they did a surgery. They sucked at one point in their career. Every single person that you want to be like and has the traits that you want to have and has maybe the profession and the accolades that you have, no matter what the profession or it is, they at one point sucked at it. So don't expect that you're going to be any different. And so I think understanding that there is a journey and there is a path of this is what I want to be, and knowing that you're not there yet and that in order to get there, you are going to have to suck. But the big thing is to not get discouraged along the way, or else you'll never get to that point. So it's a mindset thing for sure.
Unbelievable. You've grown. My grasshopper is growing. But I still have more GDVs under my belt than you do still. So
Yeah, and you will for probably a very long time.
you'd be amazed. You'd be amazed because, Penn is kind of like the emergency clinic for Philadelphia, if I'm not mistaken.
Mm-hmm.
Right.
Yeah.
So, well, congrats again. Congrats on the engagement. Congrats on finishing internship. Congrats on getting into that residency. The fact that you got right into one is unbelievable.
Thank you.
What's the percentage of that, by the way? May I ask? I didn't ask you that earlier.
Yeah, I don't know what the actual percentage of rotating internship to residency is, but what the actual like percentage of matching into a residency in general is I don't know what it was this past year, but in the previous years it's been between like 20 to 25%.
Wow, Georgia hit it
So
right out of the park then.
yeah. So I don't know exactly what rotating to residency is though.
Well, yeah, because I mean, most people say they have to go do an internship. Even you said that last year. Yeah, I'm going to have to go do another internship. Then I can do a surgical residency. So, I mean, that's awesome. Do you think the numbers are falling, or do you think they need more?
I like the numbers of matching.
Yeah, no, just doing residencies in general. You think they're just trying to get more specialists out there, or do you think the people applying for residencies has dropped?
Yeah, I think the people applying for residencies is higher now. I think veterinary medicine in general is becoming more specialized. If you, I had also another mentor. This is a different mentor that said that veterinary medicine is always about 15 to 20 years behind human medicine, and so I think it's becoming more common to specialize now. So there might be more spots opening up for residency to kind of fit that drive to more specialists, but I think overall the percentage of people that are applying to a residency is higher. It's probably that if you were to look at a graph, it's probably increasing over the years.
Ultimate goal: specialty clinic or academia?
Specialty clinic. I want to own my own surgery center with my fiance.
And what is she wants to be a surgeon as well?
Yeah, her and I both
Oof.
want to fix bones.
Yeah, good luck. Good luck. Good luck. That should be fun. Can I give you, being married to a veterinarian, I'll give you some quick tips. Number one, they're always a better veterinarian than you. Just remember that. Okay, just remember she's going to be a better surgeon than you. Number two, don't work at the same place.
Well, I think one thing that's nice is our goals are very aligned. In that, like, I want to be owner and I want to be kind of like more business, or not more business, but like I want to be kind of more responsible for making the decisions of the business. She just wants to cut. And so I think that fits because we're not going to be, butting heads on that aspect. But her and I work very, very well together. And so I think, yes, she is going to be the better surgeon and the better veterinarian for sure. She's the shit. So
yeah, that's how my wife is. So you're a blessed man, my friend, very blessed.
yeah.
So, well,
sure.
Congrats again. And then now I got to follow you through your residency.
Yeah. This is going to be
I'll check in again with you in a few months. I'm going to be like, okay, where are we at? Did they take the training wheels off? Where are you? I really want to follow this path with you because first off, you're a great guy and you're very humble. You were a D1 athlete just like I was. So we have a lot in common and we have a lot of beliefs in common. And I just want to hear your story as you go through. It should be interesting.
Yeah.
And don't be surprised if you get that academia bug. Do not be surprised.
Yeah, we'll see.
Yeah. Well, I mean, you can also have your specialty clinic and take on interns, right?
Mm-hmm.
And do all that stuff.
I do love teaching. Like I love working with students. I love.
You love mentoring.
I love mentoring.
It. Yeah.
Yeah.
Which is unfortunate. This profession is really missing that.
Mm-hmm.
So it is unfortunate. Well, Jake, it was great talking to you and to the listeners. If you got any questions from Dr. Rastas, soon to be surgeon, how do they get a hold of you?
Yeah, I would say my Instagram is probably the best way. If you want to like message, you can message me there. I'll respond. But it's at Jake Rastas. That's Rastas is my last name. But yeah, probably just message me on Instagram or something.
Sounds amazing. And if you can't get a hold of him, anyone can get a hold of me on any of the socials, and I'll be more than happy to pass on the questions. Jake, congrats. It was so good
Thank
talking
you.
to you. And we'll catch you next time here on Irreplaceable Truths.
Yeah. Thank you. Pleasure to see you again as always.